Okay, I'm scanning the room for my head to toe video. There's nothing on the walls or the ground or the ceiling. That's Anthony. Okay. Let's set it up. Okay. Ready? Okay, you can sit. So, hi, I'm Ashley. I'm going to be your student nurse today. I'm going to have class sanitizer because my hands are not visibly soiled. I'm going to shut the door to provide privacy. How are you?
Good, how about you?
Good. All right, can I see your wristband? Can you give me your first, last name, and your birthday?
Anthony Croft, 010495.
All right, can you tell me where we are?
We're in the CHP building downstairs.
Okay, and then can you tell me what day it is?
It's April 5th, Wednesday.
Yeah. Okay, so the patient is A&O times 3, learn oriented. The patient looks his stated age, which would be in his 20s, low 20s. He's well groomed, his hygiene is good, there's no bad odors, so that's good. He seems like there's no obvious signs of illness. He seems happy, he's calm, and his speech is clear. I can understand it, and it's logical. Do you have any pain or allergies? No? Okay. So I'm going to move on to the head. So the skin color is consistent with the stated race. The hair is like black or a dark brown. It's evenly distributed on his face and his chin. It's well kept. I don't see any signs of lesions. If I was to see a lesion, I would do A, B, C, D, E, which is asymmetry, border, color, diameter, elevation. I'm going to start feeling. Okay, I'm just looking, and the hair is moist. It's coarse. Its temperature is, his head and skin temperature is very warm. I'm going to move on to the eyes. So the pupils are round and they're equal. They're both 2 millimeters, or 3 millimeters actually. They, let's see if they're reactive to light. I'm just going to shine this light by your eye. Alright, and that one's reactive. It goes down to a 2 millimeters from the 3. And then can you follow this for me? And they accommodate. So the eyes are perla. I'm going to have you check this. Okay, the conjunctiva is pink and it's moist. And the eyes are symmetrical on the face. They're in line with the ears. Now I'm going to look at the mouth. So the lips are pink and moist. No dryness. Open, please. The oral mucosa is pink and moist. No lesions. The uvula is pink and moist. Can you say ah? It rises midline. The tonsils are pink and moist. They're about a 1 to grade. They're +1. The tongue is pink and moist. There's no coating. Can you smile for me? The teeth are white. They're aligned. There's no signs of dental caries or any appliances. And the gums are not retracting, and there's no lesions, and they're pink and moist. All right, I'm going to do your facial nerves. So this is going to be sharp, and then this will be dull, okay? And just let me know where you feel it. So, feel it?
Sharp on the forehead, dull on the cheek, sharp on the chin, dull on the cheek.
All right, so that's for cranial nerve 5, and then can you smile for me? All right, cranial nerve 5 is intact. Can you puff out your cheeks and raise your eyebrows? All right, cranial nerve 7 is intact. The facial features are symmetrical. There's no signs of drooping or anything. Even with doing the test, there was no drooping. So that's good. I'm going to move on to the neck. I'm going to listen for bruise in the carotid first with the bell. All right, so take a deep breath for me and hold it. All right, I don't hear any bruise on that side. Same thing. Hold it. And I don't hear any bruise on that side either. So now I'm going to feel the carotids. So the left carotid is a +2 and its rhythm is regular. The right carotid is a +2 or +3 and the rhythm is regular, so they're equal bilaterally. I'm going to have you lean back from me. And then you can lean forward. Okay. And there's no signs of jugular venous distension. Now I'm going to move on to the arms. So the color looks consistent for stated race. The hair is evenly distributed. There is a lesion right here, and it is symmetrical. The border is regular. It's a dark brown color. The diameter is about 1 millimeter, and it's slightly elevated. Now I'm going to palpate for temperature. The arms are warm, and they're moist. I'm going to feel for the brachial pulses with my end fingers, not my pointer fingers. And they are +2, and they're equal bilaterally, and their rhythm is regular. I'm going to do the radial pulses. And they are also +2. The rhythm is regular, and they're equal bilaterally. Okay? Now I'm going to look at your fingers. Can you do this for me? Put them together. There's no signs of clubbing. I'm going to check your cap refill. Okay. And they're all refilled under 3 seconds, so that's good. I'm going to have you grasp my hands right. All right, strength in the hands is 5 out of 5, which is good. So I'm going to do your heart assessment, so I'm just going to feel. So second intercostal space, right sternal border is the aortic area, moving across. Second intercostal space, left sternal border is the pulmonic, moving down 1. Third intercostal space, left sternal border is Erb's point, down 1 more. Fourth intercostal space, left sternal border is tricuspid, and moving down. Fifth intercostal space, mid-clavicular line is the mitral, and that's where I would listen for a minute to get the apical pulse. So I'm just going to do that with the diameter, or the diaphragm first. All right. Okay, and that's at the aortic. Pulmonic. Erb's. Tricuspid. And this is mitral. And that's where I would listen for 60 seconds. And now I'm going to listen with the bell, starting at the mitral area. I normally listen to the shirt. This is tricuspid, this is Erb's. This is the pulmonic. And then that is the aortic. So I heard S1 and S2, no S3 or S4. There are no murmurs. S1 was loudest at the apex, and S2 was loudest at the base. So now I'm going to move on to lung sounds. So I'm going to start with the anterior lung sounds. Just take a deep breath for me, okay, every time. First lateral one. That's my second lateral one. So the anterior and lateral lung sounds are all clear. There's no adventitious sounds. I'm going to have you spin for me. Sorry. Now I'm going to do the posterior ones. So go ahead and breathe in. And all posterior lung fields are clear, no adventitious sounds either, so no crackles or wheezing or anything like that. I'm going to have you stand up and face the wall. Let me know if you feel any tenderness. Any tenderness? Okay, and then I have you lean forward for me. The shoulders were straight too. And I'm looking, and the spine is aligned, and the hips are also aligned straight and even, so you can see that, and the spine is straight and aligned, so no scoliosis. And then now I'm going to have you turn towards the camera. And the transverse diameter is in a 2-to-1 ratio of the antero-posterior diameter. Now I'm going to have you lay onto the table. Just this. The abdomen, your shirt. Alright, so the contour is flat. It's not enough to be scaphoid. It's symmetrical. The hair is evenly distributed midline. There's no scars and there's no lesions. If there were to have a lesion, I would do A, B, C, D, E, which is asymmetry, border, color, diameter, elevation. I'm going to start by auscultating each quadrant. So I'm going to start with the right lower quadrant and going around like the umbilicus, so the right lower quadrant. That has normal active vowel sounds. The right upper quadrant has normal active vowel sounds. The left upper quadrant has normal active vowel sounds. And the left lower quadrant has normal active vowel sounds. So now I'm going to list the organs in each of those. So in the right lower quadrant, there is the appendix and the ileum. In the right upper quadrant, there is the liver and gallbladder. In the left upper quadrant, there is the stomach and spleen. And in the left lower quadrant, there is the sigmoid colon and the left spermatocord. So now I'm just going to have you tell me if you feel any tenderness as I'm palpating, okay? And I'm just doing light palpation. I'm also feeling for any enlarged organs, which I'm not, and I'm dragging across. I'm not feeling anything, any pain? No, okay. Going down, I don't feel any enlarged organs, and across. So no enlarged organs or masses or anything like that. And we already checked for jugular vein distension. You can pull your shirt down and sit up here. Now we're going to check the legs. So you can take off your socks and shoes. Turn it down a little bit more so you can see. All right, so the color of the legs is consistent with stated race. The hair is evenly distributed. I don't see any lesions. If I was to see a lesion, I would do ABCDE, which is asymmetry, border, color, diameter, and elevation. I'm gonna feel for temperature, and they are warm. The skin is warm. Checking for edema. There's no signs of edema. I'm going to check the posterior tibial pulse, and that is a +2 by equal bilaterally, and its rhythm is regular. Now I'm going to do the dorsalis pedis pulse, which is a +2, and it's equal bilaterally, and its rhythm is also regular. Have you push against me? All right, and then pull. And the strength is good in the lower extremities. It's a 5 out of 5. I'm going to have you go. You can put on your socks if you want, or you can just go.
Let's go.
All right, I'm going to have you, I'll just hold this so we can see. I'm going to have you sit in the chair and then just stand up and just try to do it in one motion and just walk a few steps for me. Okay, so he was able to get up in one motion, and he was able to do it fluidly. There was no extra effort involved. It was effortless. And then his gait, when he walked, you can walk again if you like, is rhythmic and smooth and effortless as well. I'm going to perform the Romberg test, so I'm just going to have you stand straight. I'll try to face this way. Just close your eyes, and then I'll just have you try to stay straight for a little bit. Okay, and I'm just assessing for any dizziness or anything like that. Do this for 20 seconds. All right, doing a good job. All right, the Romberg test is negative. I think I've covered everything. Thank you. That was my head-to-toe assessments complete. Thank you, Anthony.